I will let our presenter take it away.
All right, good morning, everyone. If you guys could please turn on your camera so that I can talk to you all. My name is Tamara P. Fields, and I am a licensed clinical social worker in the state of Illinois as well as the state of Texas. I am a private practice owner, so I run a mental health clinic here in Texas and a mental health clinic that is in Homewood, Illinois. So I am here today because we are in the time of our lives where your mental wellness is very important. And so what we're going to do today is kind of talk about what mental wellness is. And then we're going to talk about how to identify when your mental wellness is not so well, and then things that you can do to make sure that you keep your mental wellness intact. So please feel free to ask me any questions. I love to engage with my audience. So I don't want to feel like I'm in the lecture hall because we're not in the lecture hall. So I would love to engage with you guys. So having your camera on helps me to be able to do that. Please put all your questions in the chat. I want to get to as many questions as I can. Please make sure that you have pen and paper because there will be a quick quiz that I'm going to give you guys. So if you could go ahead and grab pen and paper, and you're going to number from 1 to 20 so that when we get to that slide, you're already prepared to go ahead and read the questions and we can just keep rolling. I want to make good use of our time. So if you have questions that you already know are on your mind, if you can put them in so that if there are some questions that are similar, the moderator can go ahead and just kind of ask me one broad question. So that will help us to conserve a little bit of our time. So people are still coming in as I see, but I am going to go ahead and get started. So we are talking about managing your mental wellness during the pandemic. As we all know that we have been in this pandemic for over a year now, and it has taken us some time to adjust and to learn what we should be doing during this time. So what we're going to talk about is what is mental wellness. So I have to figure out these slides. I have two screens going on. So forgive me if you're like, that girl does not know what she's doing. It's perfectly okay. Extend me some grace. I'm going to get it done. So the first slide is about what is defining what is mental wellness. So being mentally well means that your mind is in order and you're functioning in your best interest. Please don't forget to mute your lines as you're coming on so that there's not a lot of feedback that you guys give me and that other people are able to hear, as well as the interpreters are able to hear. So I appreciate that. So what is mental wellness? Is being mentally well means that you are functioning in, your mind is functioning in the best order and in your best interest, and that you are able to think, feel, and act in ways that create a positive impact on your physical and social well-being. Okay, so a lot of times we think that some things that we experience are things that are normal. And we oftentimes don't even consider that our mental wellness is an issue, and it's our primary issue that we should focus on a consistent basis. And so we're going to talk more about that. What is mental health? Mental health is your state of well-being in which an individual realizes their own abilities, they can cope with the normal stresses of life, they can work more productively, and they can make a contribution to their community. So a lot of times what we know is that there's a lot of stigma around mental health, and the pandemic has not helped people's mental health. So we have to make sure that we destigmatize these ideas and thoughts about what mental wellness is, what your mental health is, and the reasons that it's important. When you think about your mental health, if your mind is not together, then how can the rest of your body function in a way that is most conducive for you, for your loved ones, for your family, for your friends, for your work environment? That's not going to happen. And so it's important that you, one, know when your mental wellness is getting off, and that you do the things that are necessary to keep things in a good space for you. So Signs that your mental wellness is not so well. Are you eating or sleeping too much? Let's be very clear. Just because you sleep 4 hours a day, that does not make 4 hours a day normal. And even though you can function on 4 hours of sleep, you are not functioning to capacity. So let's think about, are we eating or sleeping too much or too little? Taking care of your sleep habits and taking care of your eating habits are major factors in making sure your mental wellness is together. If you don't have enough nourishment, your brain is not going to function in the way that it needs to function. So it's imperative that you are consistently eating, that you don't go long periods of time without drinking. All of these things are very important for your mental health. Are you always pulling away from people and your usual activities? So do you isolate yourself from your loved ones, from people, and just sort of, you're like, well, I just don't want to be bothered with people. I'm just not a people person. That may be some indicator that your mental wellness is not very well. Do you have low or no energy? If you feel exhausted all the time and there is no medical reason to support that level of exhaustion, there's a good chance that something is happening mentally that is now impacting you physically. Feeling numb or like nothing matters. Are you a person that's always like, well, I don't care? You never have an opinion, right? You just are kind of disconnected from everything. So when someone asks you a question, your opinion doesn't matter. You don't have anything to say. Your mental wellness is probably not where it needs to be. Having unexplained aches and pains. Sometimes we have a lot of things that will manifest physically that we think, oh my God, my body is breaking down. Sometimes our bodies are breaking down. Most of the time, it really has to do with what's going on in our head. And what we understand and what we know about trauma is that trauma gets stored in your body. Even though your mind can put a traumatic experience situation away, your body will hold the experience that you've had. And so sometimes what you're feeling is an event that was emotional and mental that then impacts you physically. And so you're constantly responding from a physical place because you're exhausted, you're really tense, right? If you find yourself being really anxious all the time, then what's happening when you're anxious? You're contracted a lot. Your muscles are tense all the time. You're not relaxing yourself. And so then you're just kind of like, my body is in pain all the time. If you don't have a medical reason that explains that pain, then you really have to check your mental wellness. Feeling helpless or hopeless, right? It's one thing to have experiences that don't make us feel good, but losing hope and not feeling like there is help, losing hope means that you don't see a future for yourself. And if you're unable to see a future for yourself, then you're unable to see yourself moving forward in so many areas of your life. And so if you find that you're a person who doesn't have much hope anymore, then there's a good chance that something has happened that you may not be aware of that really has had a very negative effect on your mental wellness. And so it's important to know, do I still have hope? Hope will compel you forward. Hope will say, okay, I know you don't feel like doing something, but hope helps you to get there, right? It's kind of that thing that propels you to do the things that sometimes you don't want to do, right? How many of us don't feel like taking care of our kids when we're tired? Like, let's just be true and let's be honest. I know when I'm tired, I want everybody to leave me alone. That doesn't mean I don't want to parent anymore, okay? So think about that. Am I refusing to do things that I know I'm assigned to do, that I should be doing, but I just don't want to? I've lost hope. I don't want to do it. Are you smoking, drinking, or using drugs and or alcohol more than usual, right? What happens when we're under high levels of stress? We're like, okay, when I come home tonight, I'm going to have a glass of wine. Maybe that was the norm. You had a glass of wine, it helped you to relax. But what happened as the pandemic happened is that we needed more wine to relax because of the trauma that we were experiencing, because of that vicarious trauma, which is secondary trauma of what we get from watching the news, from hearing other people's stories, from hearing about people that we don't even know about being sick with COVID, dying from COVID. all of those things. And so if we're using alcohol or smoking to help us to relax, as we get more and more stressed or distressed, then we increase the amount of alcohol and smoking that we need to do. So, for people that drink and smoke, I just want you to take a moment to self reflect and say, during the pandemic, did my drinking or my smoking increase? I will guarantee you that more than likely it did. As well as, we have those COVID pounds that we're dealing with still today, right? You're like, hey, everybody's at home. I remember when COVID hit and I went to the grocery store, I was like, how is there no flour? How is there no brown sugar? Because people were preparing to bake things, to do a lot of cooking because we were confined for the most part to our homes. And so you have to think about the level of increase that happens for the things that give us pleasure when we're in a place of distress. And then feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared. Okay. So we know that COVID brought on all of those feelings to the highest extent because we're running from something that, one, we didn't understand what it was. We didn't know what to do with it. We couldn't tell who had it and who didn't. And so it made it really complicated for us emotionally to get it together. And so, yes, there was an increased state of confusion, increased forgetfulness because your mind is cluttered, your mind is confused. And so, COVID didn't help you with your mental wellness. And so, if you have any of these things, this is a sign that your mental wellness is not so well. Additional things are, were you yelling or fighting with families and friends? One of my primary things that I do in my private practice is we provide services to child protective services. Child protective services has always had a high rate of clients just because of the high rate of child abuse. When COVID hit, the numbers were just astounding. Like the numbers increased so rapidly. We immediately had a wait list because more children were being abused because they couldn't go to school. The parents were frustrated. Some children were in domestic violence situations. And so there's more fighting because you're crowding each other's space when you're used to being away from each other 10 to 12 to 14 hours a day. Now you're with these people that you live with, and although you love them, you don't want to be bothered with them 24/7. But a lot of people didn't have a choice in terms of doing something with their children or being away from their loved ones, which increased yelling, screaming, fighting in the home, which increased child abuse. Okay. And so, again, that was a sign when people's mental wellness was going off the rails, but people didn't know what to do. Experiencing severe mood swings that cause problems in relationship. Lots of relationships have fallen apart as a result of COVID. It's too much to manage. People lost jobs, right? People lost homes. There was a lot of loss, and there continues to be a lot of loss, and people are trying to recover from this impact of COVID. So having persistent thoughts and memories that you can't get out of your head. So the replaying things, for people who may have lost loved ones or have some vicarious trauma, replaying what happened over and over and over in our minds, which is why it's so important that when we have an experience, one, that we outwardly talk about the experience so that we process it. But the danger is that our minds give us the ability to think something 1,000 times over, just kind of think about it over and over and over and over. And so when that happens, yes, we're going to be persistent about it because that's the way that the brain works. It will give us the ability to think about something, to rewind and play, rewind and play, rewind and play. And so we have to be careful to take control of our thoughts when we know that the thoughts lead us into unhealthy space. Hearing voices or believing things that are not true, right? This is a part of when your mental wellness is not so well. It's also what we call hallucinating, right? We start to believe things that are not true. We start to hear voices that other people do not hear. We may even see things that other people do not see. We may hear someone telling us to do something when there's no one else in the room with us. Those are signs that your mental wellness is in question. thinking of harming yourself or others. We know that during this pandemic, that there was an increase in suicide and there was an increase in self-harm, not just among adults, but also among children. And so we have to also know when we have thoughts of wanting to cause harm to ourselves, even if we do not have a plan to cause harm to ourselves, that is your trigger that you need help, you need support, and you have to be the person to reach out, get the help, get the support. And we also have to be able to tune in to people that we love and listen to them as they speak for clues that they may give us that their mental wellness is not so well and that they need help. The inability to perform daily tasks like taking care of your kids, getting to work, or getting to school. Those are also signs that your mental wellness is not so well and that there may be some depressive symptoms that you are struggling with. You cannot get your normal daily activities done. Those are huge red flags that your mental wellness needs to be addressed, potentially by a professional, and potentially by a professional and by medication, right? So you have to think about, am I aware of the warning signs of when my mental wellness is not so well? Okay, so here's where I want you guys to take a few minutes. I want to give you a few minutes to take this test because I want you to read. There's 20 questions. So if you can grab pen and paper and you can label 1 through 20 on your paper, I want you to read each question and you're just going to simply answer yes or no. So I'm going to give you a few minutes to do that. I'll give you about 2 minutes on screen 1, maybe another minute on screen 2 or whatever. And then I'm going to go to the next screen. I want you to just answer each question with a yes or no. And then you're going to add up all of your yeses. And I will then tell you what the yes means. Okay. So I'm just going to mute myself for a few seconds while you all do that. All right. I'm assuming that we've had enough time and we can maybe go to the next screen. Does anybody need extra time? Sarah, can you let me know if anyone is saying yes, they need extra time on this screen?
Yes, can we give them just another minute? Looks like there's
Yes.
who would like to.
Okay. All right, I'm gonna go ahead and go to the next screen. If anyone needs me to come back, just put it in the chat and I'll be more than happy to go back to the previous screen. All right, has everyone had enough time? So what you're gonna do when you're done with all of the questions, please count all of your yeses.
And there is somebody asking for just another minute. If you can just go 1 more minute.
Absolutely.
It looks like we're ready to go now. Thank you.
All right. So if you have all of your yes, then we're gonna go ahead and tell you how to interpret the scores that you have. So if you have a score of 1 to 6, that means you have few hassles and you're probably managing within a normal level of stress. Any score of 7 to 12 means you're doing pretty good and you kind of have control over things. Scores of 13 to 17, you are in a danger zone and you really should pay attention to your stress levels because you are going into distress. And then anything that is 18 or above, you are stressed out. So if a few of you don't mind sharing what your numbers were, so we can just kind of see where have people felt like they were based on the questions that were asked. So just drop in the chat what your numbers are. And Sarah, if you could just kind of read off some of the numbers to me, that would be great.
Absolutely. Thank you to everybody for sharing. Looks like, let me get back up here. There's a lot of people who've shared. So thanks. 11, 10, 16, 11, 11, 8, 12, 13, 11, 10, 8, 5, 11, 9, 9, 12,
One of them, yes, the rest are for Nolan School.
11, 6. Yeah, so thank you. Lots of people have shared. Looks like, do you want me to keep reading or does that give you a pretty?
Just a couple more.
Okay, sure. 6, 9, 14, 5, 11, 15, 5, 14, 9, 18, and then 4 and 2.
All right. So thank you so much, Sarah. So thank you all for taking this time and answering the questions just to sort of self-evaluate. It sounds like in the larger group, people are doing really well with managing your stress. And so certainly I would have expected that because we are sort of a year plus into the pandemic and we've learned how to work around it and we've learned how to better deal with it. If I probably had given this test at this time last year, I would have been at about 100, okay? And there weren't even 100 questions. But a lot of us probably would have been in the score of 18 plus because we were really stressed out. And so it is important to evaluate yourself. You can come back to this slide because it's going to be up. And what you may want to do is just kind of take a picture of these once they get posted on the site to say, let me learn now to manage my stressors, right? Let me ask myself these questions just to sort of see where I am. And so it sounds like you guys are doing really well. And so I honor and commend you guys for doing a very good job with managing your stressors even now, okay? So let's talk about the difference between your stress and distress. And so when we talk about your stress, that's positive stress, right? Stress that sort of gives us motivation, stress, and stress is normal. So let me also say that part. A lot of times we think, oh my God, we shouldn't experience stress. We're gonna experience a plethora of emotions. Stress is an emotional state and it's okay for us to experience stress. What we want to do is make sure that we are staying within this space right here. where we see positive stress and we're able to focus within this window, there's focused attention, emotional balance, rational thinking, right? There's stimulation and motivation. Too little, right, puts us into impaired attention, boredom, confusion, and apathy. Too much impairs selectivity, excitement, burnout, and disorganized behavior, right? So we want to make sure that we stay in this window of tolerance and that we don't go too far left or too far right or too high or too low. That is very, very important. We have to learn, excuse me, where we are in terms of our stress levels and what is our baseline. You have to know, where do I normally function when I have stresses in my life? And am I above that or am I below that? And how am I managing my stress now? Okay. So stress versus distress. Stress is an emotional response to the demands of life. Good stress activates us to use our personal power in positive ways to meet our needs, desires, and wants. Distress is our inability to get our basic needs met. Distress drains us physically, emotionally, and socially. It shows up in symptoms like headaches, backaches, ulcers, diarrhea, fatigue, anxiety, depression, lashing out, or withdrawing from others. Chronic distress can result in severe illnesses such as colitis, cardiac problems, stroke, and cancer. The research shows us that there is a direct correlation between our stressors and how they manifest in us physically. We have to make sure that we are keeping our lives as balanced as we can. One of the things that I always tell my clients is to control what you can in your life. And for the things that you cannot control, choose. Did y'all hear me? Write that on your paper. Choose. You have choices. Choose how you will handle them. If we don't have money, there is no point to worry about how the bill is going to be paid. The money won't fall out the sky. However, a blessing might come. But in the meantime, I'm saying control what you can, and what's out of your control, choose how you're going to engage with it. So much of our life is out of our control. And so when we learn to be okay with the things that we cannot control, then we learn to just work with what life gives us. Does that make sense to you all? Work with what life gives you, because we don't control what life will hand us. So, does anybody see themselves on the screen right now? Just type yes in the chat box. If you see yourself on the screen right now, just type yes. I'm not asking you to disclose which photo is you. I'm just saying be open, honest, and authentic with you about how you experience yourself. If this is you, just type yes in the chat. What we getting, Sarah?
A lot of yeses.
A lot of yeses. And I expect that everybody should have gone into this chat box and said yes. I can go into this chat box and it's a yes for me also. There's a few faces of me that are on this screen. And so I want you to just kind of keep this in your mind about what these faces are. It's everything that I just talked about, right? And so you want to just know, right? We talked about when it affects your body, right? Just kind of feeling alone and separated, having headaches, overeating, not eating, being angry, just kind of staring off into space, chronic physical illnesses, not wanting to get out of bed to do anything, consuming alcohol. Do y'all see these bottles? This is somebody's real life. This is somebody's real level of stress. And so we have to make sure that we minimize how many of these faces of distress represent us. All right, so the effects of the pandemic on mental wellness. So when we look at our kids, right, what we've seen is the impact, right? Kids love to do what? They love to play with other kids. Teens love to be with their friends, right? When they sort of get to middle school, parents are no longer important. Family is no longer important. The only thing that matters are their social relationships, their social lives. And so what we know is that girls have struggled more than boys. And so this is a very good description of how our kids have managed their mental health during this pandemic. So the effects of it is that things have worsened. Higher levels of anxiety among girls, higher levels of depression, sleep issues, withdrawing from family. Do y'all see the aggressive behavior between boys and girls? We've seen this phenomenon over time where girls are increasingly becoming more aggressive. And a lot of times the aggression is about some pain that is stored somewhere. So please pay attention to your children because your children are paying attention to you. How you manage your mental wellness is also what you teach to your children for how to manage their mental wellness. So it is imperative that we do this and that we do it to the best of our ability. So during late June, 40% of US adults reported struggling with mental health or substance abuse issues. Do you guys see these numbers? Traumatic stressors, related disorders, 26%, anxiety, depression symptoms, 31%, started or increased substance use, 13%, seriously considered suicide, 11%. And this was just based on surveys of US adults more older than 18 during June 24th through the 30th. This is based on 1 week. 1 week. So, amidst the coronavirus crisis, Americans are already suffering and fear their future, right? So remember, we just talked about controlling what you can and what we can't control, make a decision about how we're going to deal with it. So people who were already suffering was at 72% says it's disrupted their lives a lot or some. 39% say they've lost a job or income. 45% say it's affected their mental health negatively. So these were the people who were already suffering. Look at these numbers of the fear of the future, 74%. The worst is yet to come. 79% worry that the pandemic will trigger a recession. 82% fear the nation's health system will be overrun. These are the statistics. And so you have got to make sure that you are managing your mental wellness as best as you can. People are living in the day of fear, where fear is really ruling people's lives. Younger adults are more likely to report symptoms of anxiety and/or depressive disorder during the COVID-19 pandemic. So, young adults have been more open about what's happening, right? But that doesn't mean that they're the only ones struggling. What it means is that they're the only ones reporting the struggle, because a lot of us are struggling and we just don't say anything because struggle is normal for us. And so when we've normalized such a thing, for us, there's nothing to talk about. There's nothing to say because this is within your normal window, okay? So 56.2% between the ages of 18 and 24, 48.9% between 25 and 49, 39.1% between 50 and 64, and then 65 and older, 29.3%. So please, please, please pay attention to your loved ones. Ask questions. Ask them, how are you doing, right? Not just you know how you walk past people every morning and you're like, how are you? And people just automatically say, I'm good. How are you? Because it's automatic, right? It's just a mindless behavior. But be more mindful of when you're asking people how they're doing, that you're really stopped and you think and you ask the right questions and you are attuned, connected, and you're listening, right? Because people will say that, I'm okay. If you say, I'm okay, I'm going to say, help me understand the because it wasn't a flat okay. But we have to be paying attention enough to people, be mindful of what people say in order to ask the right questions. because some people need to be led into their struggle. They need to have a window or door open that will allow them to talk about what their challenges are. Okay? So, who is at
Tamara?
risk? Yes?
I'm sorry to interrupt you, but what you're saying is definitely resonating with the participants today. And a couple of people have put some things in the chat that I really think that they want you to hear. So do you mind if I read a couple of the comments?
Oh, absolutely. Go right ahead.
So somebody, I mean, we really appreciate people being so authentic. Somebody has shared that they've been hospitalized twice last year because of stress illness. And somebody has shared that it's been a horrible time to raise two teenagers. Another person shared that their son just started his third quarantine yesterday due to contact with a positive person and positive family members. And it's definitely affecting his mental health. Once we were down, we will have quarantine for 52 days. So
Wow.
people just sharing some of their personal experiences with you.
Thank you guys for being so transparent and being so honest and open. This is how we really start the conversation. So I appreciate that you guys are sharing in the chat box. I can't see the chat based on how I have my screen, but please feel free to keep sharing, and Sarah will tell me about these things. So thank you guys for sharing. And yes, it's real. I don't have another word to say. I wish I could give justice to the impact of it, but I just think that being able to give justice to it is going to be so far into the future where we really can sort of give a very good experience because we're still in it, right? It's kind of hard to try to explain something that you're still experiencing, and we're still experiencing it. It is so true that if we are not mindful, right, a huge impact. Like it's a terrible time for children. I've had more kids and adolescents and teens on my caseload than I have in a really long time. And the level of anxiety that children are experiencing because they're afraid, like they don't want to go to school. Every morning it's a tummy ache because they're scared of going to school, because they're scared of getting COVID, but their parents have to work. And so it's a very, very difficult things for families to deal with. So thank you all. And so who is at risk during the pandemic? Older adults, children and teens, people with pre-existing mental health conditions, including substance abuse, service area professionals, and then people with chronic diseases. But we're all at risk is the truth. It just appears that this group of people, they're more at risk potentially because they could be more exposed, right? It's hard to tell kids, don't be kids, don't play with your friends. You can go outside, but you can only play with each other. It's difficult for kids to understand that. And so these are the populations that have been identified that are probably at highest risk, okay? So what are some proactive responses that we can take with dealing with our mental wellness and dealing with the pandemic? One is to exercise. I know, I hate it too. I don't want to do it, but there are benefits to it, right? It's okay to get outside and just take a little walk, even if it's just 5 or 10 minutes, it will make a difference. So you have to be willing to exercise. If you don't feel comfortable going outside, walk around your house. Just walk around your house. Walk in place, walk circles. Just kind of get some of these things moving. Put positive hormones into your system, because we know that stress gives us what? High levels of cortisol, high levels of adrenaline. Those things, too much of them, are not healthy for us. And so exercising sort of helps us to combat that. Limit your unhealthy foods and drink. What happens when we are stressed out? Be like, I'm about to eat me some chocolate chip cookies. I'm about to drink me a soda. It used to be my go-to when I was stressed out because it's been a long day at work. I'm having me a Pepsi, okay? And I didn't realize the impact that the sugar was having on my system. And so it is important to limit those things, although they make us feel good, right? Those are comforting foods, but our comforting foods are not healthy for us. So we have to be mindful of that. Take breaks when working. Stop letting them work y'all to death, okay? Stop it. You got to take a break. When you are dead and gone, they're going to replace you. So it's okay if you take your lunch break. It's okay if you take your 15-minute break. It's okay if you go to the restroom. Did y'all hear me? It's okay to do that. They don't pay you for your life. They pay you to provide a service for their company. You guys have got to be mindful of how you balance your home and work life. Okay? You know, at the end of that job description, it says all other duties as assigned. I just love it. What does that mean? That means we can tell you to do whatever we want you to do whenever we want you to do it. All of that's lovely. And with all due respect, do not allow your job to kill you. Okay? Social media hiatus. Please be mindful of what you take into your system. Be mindful of what you listen to. Be mindful of what you see. Vicarious trauma, which is secondary trauma from other people's experiences, is very real. You have to limit those things. Do not just sit and watch the news 24/7, story after story after story after story after story, death after death after death. You have to stop, take a break, turn off your social media, and be present in your home. Be present with yourself. Do some relaxation. Get away from all the things that will potentially make your mental health worse. Strengthen your support system. Reach out to your loved ones. If you don't have family, connect with your friends. Check on your neighbors. Say hello. Make a support system for yourself. It could be the same people you see when you drop your kids off at school. Say, hey, let me have your number. I see you every morning. I just want to check on you. Increase your support system, and then seek professional help when needed. Okay? Do not let people make you think crazy people is who go to therapy. It is so far from the truth, right? Who is a crazy person? A crazy person is the person who does not seek out anything that they need for themselves. Because other than that, us mental health providers, we don't use words like crazy, right? We don't see crazy people. I don't even know who those people are. We see people who are struggling with everyday stressors. We see professionals, right? It's not the severely mentally ill who you think is coming to therapy. That is not who's showing up. It's the people that you walk past every day and say good morning to. Those are our clients. Their children are our clients. Their parents are our clients. Their grandchildren are our clients. And if you need professional help, it's imperative that you get it. If you guys have EAP, employee assistance programs, a lot of companies have employee assistance programs that employees are not aware of that may have a mental health component to them. Use the services that your employer is paying for yourself. Have an assessment done. Just like we get a medical checkup every year, you have to do the same thing with getting a mental wellness checkup every year. It's imperative that you do it. Manage your mental health better than you manage your physical health. Did y'all hear me? Manage your mental health better than you manage your physical health, because if you lose your mind, none of the rest of that will matter. So it is imperative. So what are mental approaches? Adopt a new attitude, increase your own self-worth, set realistic expectations. Stop trying to be super mom. Stop trying to be super dad. It is not the season to be super. It is the season to survive and thrive. That is the season to survive and thrive. The super mom thing is out the window. The super dad thing is out the window. It is a season to survive and thrive. Keep a positive outlook. Watch what you allow to come from your mind. When you think negative thoughts will control your behavior. When you think positive thoughts will control your behavior. Choose your thoughts. You have choices. Choose your thoughts. Improve your communication skills. Instead of getting upset with people and shutting down or shutting them out and not saying anything, tell people how you feel. Even if it does not change the outcome, communicate how you feel to people that you love. Leave work at work. Did y'all hear me? Write that down. Leave work at work. Leave yourself a note on your desk. So leave work at work. They don't pay you to work on your off time. They don't pay you for 24/7. Leave work at work. What you don't do today, you can do tomorrow. You can do tomorrow. Get organized. The better you are at being organized, the clearer your mind is going to be. So please, please, please be organized. Set intentions. Use block systems to get things done that you need done. And then maintain healthy boundaries. Do not let people come and dump all of their problems on your plate. You don't have room. You have room to support people, but you don't have room to deal with their stresses because you have your own. So if someone comes every day and they just want to complain, what do you want to do about the thing that you're struggling with? Just ask them, do you want to do anything different? If they only want to complain, let them do that on their own time with their own selves, okay? All right, so we are down to questions. Are there any questions that you guys have? Please put them in the chat.
And yes, so you're getting a lot of thank you and great presentation. There is a question here from someone. Do you have any advice for encouraging someone to get a therapist who is hesitant or doesn't want to try it?
So yes, here's the thing. Sometimes people have had ideas about what therapy is. And one thing that is very important is to encourage people to try different therapists. And I don't mean therapy shop, but let's say you go to someone and you feel like, it doesn't feel like a good fit. If it's not a good fit, find someone who is, right? When we go to the doctor and we don't like them, what we do? We find another doctor. So if someone is resistant, I would want to identify what is their barrier, right? And saying, okay, so how do you see your ability to change your situation without getting assistance that you need? Your family can't do it for you. Your friends can't do it for you because they're not trained. And even if you have a family member or friend who is a therapist, they're not your therapist because they cannot be objective because they love you. And so they feel what you feel and they can't give you the skills, and it's an unfair responsibility to put up on them. So I would say keep encouraging them, maybe help them to make the phone call, help them to identify what questions they should ask, help them to identify what type of provider would they like. Sometimes people feel uncomfortable saying, I want an African-American provider. It's okay to ask for a provider who you feel will suit your needs. It's for your care. Ask for what you need. Encourage them to, one, know what they need so that they know what kind of provider they're looking for. Read the profiles. Go to the different pages and see, okay, does this provider speak to me, right? Does what they have in writing, does that speak to me enough to get me through the door? So I would just say keep encouraging them to, a lot of providers are on social media now. You can go to their social media pages and kind of see how they engage there. Some people go live all the time. You can go on Instagram, on Facebook, and look at their lives on YouTube, and that will let you know, is this the person? You will know when that person is the right person.
Thank you very much. And several people have, well, more than several, quite a few have said thank you very much. They needed to hear what you've shared today. We've had a couple of people indicate that they are going to share this with other people who need to hear it. And that vein, y'all, this presentation, Tamara was generous enough to share the presentation slides, and they are back where you came into this session. That's where you can find the presentation slides. You kind of talked about this. Oh, here was one other question. Let's see. Are there any studies on the added effects of loss, particularly the children and families who've survived the COVID deaths? Additionally, is there a platform that discussed the effects of the current racial climate amidst the COVID crisis?
So there's lots of conversations happening around these topics. So is there just one platform? All platforms are addressing these issues. I'm not sure how many people are familiar with Clubhouse. Clubhouse is a iPhone exclusive, basically live chat is what is basically what it is, but it's a social media app. It's invitation only, but there's always discussion. There's lots of doctors that are in those chat rooms, and they're constantly talking about the pandemic. They're talking about the racial disparities. They're talking about the health disparities. So many platforms, Facebook, Clubhouse, Instagram, you will find these conversations. In terms of the research, there's always research that's happening. The research will be ongoing because remember, COVID has just started. So we have some research and we have some data to support some things, but it's going to be a very long haul in order to really look at the effects of it. So I'm sure there are some things out there. You can try to look on Google Scholars, and Google Scholars will have some research things. You can just type in the topic, and Google Scholars will provide articles and things like that that will talk about specific research. So just search the keywords of the topic that you're looking for, and you can find those things. Any other questions, Sarah?
I think there was another person that asked specifically about helping somebody who doesn't think that they're suffering from anxiety, but they are. Do you have anything specific? I know you've covered a lot, but.
So in terms of helping someone, so a lot of times we have to do a good job at making people be educated about the difference in nervousness and anxiety. Nervousness is probably what we all feel before a job interview, before something that's really important, before we have to speak. We all have a sense of nervousness. Anxiety is disruptive though, right? Anxiety is disruptive. It paralyzes us. It makes us feel like we can't. It can send us over into a panic attack. So I think having people to understand the difference between nervousness, that's normal, anxiety, which is a condition, and then anxiety that leads to a panic disorder. Those are different things. And so a lot of times dealing with anxiety has become so normal. But what I would recommend, one, is that they be evaluated. But if they're not going to be evaluated, I actually have on the screen right now some apps that are for self-care. Calm is a meditation app. Headspace is a mindfulness app. Strides is a habit tracker. MyFitnessPal is a health tracker. And then the gratitude journal. If people are trying to do things on their own without seeking professional intervention, then you want to start getting into healthy meditation and learning how to basically get control of your body, get control of your breathing, controlling your thoughts, because the anxiety is about worrying about your future, worrying about something that's going to happen in the future, as opposed to what's happening right now. And so helping someone to understand that they have anxiety is really about educating them.
So I don't know where that came from.
Any other questions, Sarah?
We have one request. If you, when you're finished, to go back to the 2 slides with the questions, they just want to take a quick look back at those.
Okay, yes. So let me just finish off these slides. So here are some resources for you guys. So please feel free to take a picture of this, keep it in your phone, share it with the people who need it. Don't be afraid to use these numbers. If you feel like you need them or you know someone who does need them, please, please, please use the information that is made available. Use the resources that are available for you. And then I'm just going to go to the last slide and then I'll go back up. And this is just my contact information. Please feel free to check me out on Amazon Prime Video, where I am the resident therapist of a documentary that's called When the Soul Cries, Trauma, Tears, and Triumph. It's full of tears. So let me just tell you now, be prepared to be in a safe place that you feel comfortable in. Don't try to watch it, on the ride. Don't do anything like that. But please feel free to check it out. It's an amazing documentary. And it really is dealing with trauma, tears, and triumph. And me working with a group of women who were experiencing some things in which I did a healing retreat with them. So please feel free to check that out. And that is my contact information. If you guys want to follow me, feel free. All of that information will still be included on the slides, okay? So I'm gonna go back to, it's the stressor slides that they wanna see, correct, Sarah?
Yes, the 20 questions.
Okay,
And I will mention again, I thought that the slides were up on the WIOA Summit where you came in. If they're not currently there, we will definitely, y'all come back in a little bit. Well, not a little bit. Give us time to get the day through. See, I've been listening to you, so I'm going to tell them, give us a little bit of time, but we will get those slides up for you because Tamara has graciously agreed to share her slides. So that will be there for you. If it's not there, we will get it there for you by the end of the day.
all right, so here's the questions. Are there any other questions that I can answer while people are taking a picture of the screen or doing whatever they need to do? And let me know when I can go to the second page for you.
I'm ready for it. I'm ready for it.
And there's one other question while we're looking at that is, what is your stance or thoughts on the severe use of social media that is being seen in the population? What would you recommend to do with a teen having these problems and being impacted by the overstimulating situations they are viewing?
I think we have to limit and explain to our children the importance of limiting their exposure to some of these things on social media. The social media hiatus applies to all of us. And sometimes we have to help our children and our teens to help themselves. And as the parents, I know it's difficult. You don't want to fight with your kids and all of that, but we have to limit their access and we have to explain to them why that is important. And so maybe say, hey, I need you to limit your time to 2 or 3 hours or less on social media. And if that means taking the phone at night so they're not spending all night scrolling, it's worth the attitude that they're going to have about it because it's important for their mental wellness. But we just live in an era where kids are too exposed to technology 24/7. And so we have to do the parenting piece of it. And it's not always fun. It's not always easy, but it's imperative for our children that we help them to learn how to build healthy boundaries. And that means with everything that we do, right? Too much of anything is unhealthy for us.
Thank you very much. So one last request, if you could go back to the slide that talks about the Amazon Prime, they want to see that information.
Okay.
And I will save all of this chat for you because there's such many warm regards. I want to make sure you get a chance to read everything that people are writing to you.
Okay, I appreciate it. And thank you guys for coming in and being so open and being so transparent and allowing me to just talk with you about your mental wellness. Please, please, please reach out and find you a therapist if you need one. And even if you don't think you need one, the beauty right now is that a lot of people provide telehealth services. And so you can always, you know, from the comfort of your own home, we've all adjusted and learned how to do therapy online, and it's not that bad, right? And so you get a chance to talk to somebody who can't tell your business to their friends, and your family doesn't have to know about it. And you get to be able to come to us, complain about your husband, complain about your kids, get a strategy, get some tools, maintain your mental wellness, okay? And so please, please, please make sure if you do nothing else that you get an assessment. There's been a lot of grief. There's been a lot of loss. You have to deal with that. Do not normalize things that are not normal, okay? So excessive anything can be not so great for us. So please, please, please make sure you are checking your mental wellness through at least having an assessment at least once a year. Do it annually. Do it annually and just really make a habit of going to therapy. Make a habit of using your EAP services. Even if you don't think you have anything to talk about, there's stuff that will be like, hold up, let's talk about this. Do you realize sometimes we need to connect the dots for you? And so please, please, please go and get your mental wellness checked. It will be the best decision that you could ever make.
Great advice. Thank you. One more quick, and then we need to go, let our presenter go, but there's been requests to see the slide that has the scorecard for the 20 questions.
Okay.
There you go. All right, again, many thank yous. Everyone appreciates your knowledge and all that you've shared. Lots of people making some good, hey, I'm gonna do this. I'm gonna work on these different areas that you have highlighted. So thank you very much for joining.
Absolutely.
Illinois.
You're welcome. Thank you all for having me. It has been a pleasure. It has been an honor to serve you all, to provide you with information, and enjoy the rest of the conference.
Thanks, everybody.
Bye-bye.
Bye.